All right, guys, here we go. This is one of the silver bullet stretches that I would love everybody to try for the rest of their life. So our hips, our pelvis dictates what happens in the rest of our body. Okay, so laying in this stretch called supine groin stretch is going to really address any misalignments, any burning pain anywhere along the spine, even up in the neck and shoulders, anywhere along the spine. So if you can get into this position, it's a little tricky, and that's why this video is going to be a little bit longer, but if you can give this time, you're going to really see results. And I mean really see results. You just have to invest. Just think of this as an investment. How long did it take you to create pain in your body? It's going to take some time to make that pain dissipate or release that pain. So in this position, you're laying on your back, obviously. I'm on carpet. It's better on the hard floor, but space is at a premium right now. So if your tailbone or your sacrum, the triangular plate between the two elephant ear looking hip bones, the ilium, is really achy, maybe the carpet's better for you, but you're going to get into a chair position or maybe even on a couch or ottoman where your knee is directly over your hip socket. So you're going straight up with your thigh rather than push back at a diagonal. Knee joint stacked over the hip joint. And also, it's not going past the hip joint this way. It's straight up and down, okay? My heel is down on the ground, and I'm resting my knee. It's not falling over. If I need to put a pillow here to prop it so that I'm completely rested in this leg, I need to do that, okay? I'm just feeling really comfortable the way this chair is. If my heel is kicked up, if my leg, my calf on the couch or an ottoman raises my heel, it's too high. It's got to be where this whole leg is at a 90, okay? My heel has to be rested. I know this seems really picky, but I'm telling you, it's a life changer. It's Pete Egoscue's silver bullet, okay? So then we have our leg that's extended, propped up by something. And this block is not the best thing. You want to have it against a door jamb or a heavy stack of books or maybe a something that's not going to create tension in this leg. Like I have to kind of hold my foot up here. I'm just showing you as an illustration, something really solid that's going to let that foot push all the pressure into it so that I'm not using my hip flexor or any part of my thigh to keep that foot up. Okay? Palms up on the ground, not over the shoulder socket, somewhere lower, palms up preferably, or on your stomach, because we're trying to open up the tight chest muscles and just breathe here. Okay? Very, very passive it looks, right? My ankle is straight stacked from my shoulder all the way down to my ankle. Yes, my shoulder socket is wider than my hip and my ankle, but in a line. It's not way out there or tucked under. Nice straight line here too, okay? Deep breathing, diaphragmic breathing. We talked about the diaphragm. It's the top of the core, and it is so important to keep pliable and movable. So when I'm taking a deep breath in through my nose, I'm going to let my belly pull in and make the breath come up to my heart, expanding my ribs to the side. It might take a little bit of time to get used to that, okay? Because after pregnancy, everything's compressed inside. So now we're trying to open and stretch things and let blood flow come in and circulation come in and open everything up and make it be alive. Can this stretch be done with people that aren't postpartum? Guys, kids, anyone. This stretch will benefit. But my heart is for the postpartum woman. That's where my heart is. I hope you guys that are watching this try this stretch. I hope you're not just watching for entertainment, because there are channels out there that do way better. Tech-wise, entertainment-wise, all that stuff. I am here for the postpartum woman. And I just hope you guys that are watching do benefit from this stretch. You have to do both legs. You cannot do one side even if you're having pain on one side. But this stretch, I'm telling you guys, if you give it time, so depending on your pain level, will be depending on how long you need to stay on each side. 20 minutes minimum if you can, okay? We're talking about lower back pain. We're talking about thoracic pain or cervical pain up in the neck, up in the traps and shoulder blades, especially if you're nursing, especially if you've been 10 months of pregnancy. Everything is rounded forward because we're carrying a lot of weight in our front. So our shoulders tend to roll forward, our ear sticks rolls forward of our shoulders. So look at the floor, okay? I've got my ankle in line with my hip. I've got my shoulder in line with my ear, horizontal wise, right? I'm laying on the floor. Nothing else could happen otherwise. Here, gravity is my friend. So as I'm breathing deep and slow, the gravity is pulling or releasing my tight muscles around my vertebrae, around my pelvis, deep intrinsic muscles attaching into the pelvis. Even my pelvic floor is able to relax here in this position. Gravity is my friend. And girls, we know when we're sitting up, gravity doesn't tend to be our friend. We want to do this on both sides. Like I said, time it so it's equal times. Breathing diaphragmically rather than belly, lifting your belly up and down, seeing it rise. You're going to want to feel your rib cage expand to the sides. That's going to take some practice, okay? This is for the spine. This is for the pelvis. And we're making sure that our foot that's extended is straight up and down. And we're propping it against something that's very sturdy. This is not the greatest model, but right now it's all I have for an illustration. Better to be against a door jamb. You can see my foot is starting to roll out because this is not a heavy enough weight. Okay, door jamb's perfect. We're breathing deep. Now, this is for the spine and the pelvis, okay? If you feel like you're more burning up in the shoulders, there's a couple more movements we can add to this. Number one, because they're great movements to open up the shoulders and neck. Number two, it'll kill two birds in one stone, okay? So this is spine and pelvis. Now to add on, I'm gonna work on pain in my shoulders and neck. I'm gonna take my elbows and put them out to the sides so that my arms and my body are like a T, perpendicular to my body. Elbows are not higher than the shoulders. They're level, okay? And my fists are tight and my wrists are straight. My wrists are gonna wanna go back and forth like this, but I'm gonna keep them straight. That's what I'm going to pay attention to. As I drive my elbows into the ground, I'm going to pull my shoulder blades together and down the spine. Okay, I'm going to do that and hold it and then release it. Going to take a deep breath in, blades together, elbows down. I'm going to keep my forearms straight up to the ceiling. I don't want them to flail back and forth. I'm going to do this at least 10 times. Here's the real tip, okay? When I'm squeezing my blades together, keeping my forearms vertical, I don't want to arch my spine. We talked about this before. If I'm arching my spine, my belly doesn't work. There's no engagement here, so I'm going to pull my belly button in and flatten my back as I'm pushing my blades down. Okay? Lots of stuff to remember. 10 times. This is for shoulder blade, neck pain, okay? Or rounded shoulders. Then I'm going to take my palms in together like a prayer position. Try to straighten my elbows as much as I can. Breathe deep and let my wrists try and go as low as I can. Maybe the first time I'm not going to come to the ground. Come over my chest. Check out my elbow position. The pits of my elbows want to go forward rather than together, so I don't want to bend. Breathing deep. Keeping the arch of my back down on the ground by pulling my belly in, okay? So I'm going to try and come up and go a little bit farther each time. If it's really painful, taking it all the way to the floor. Don't do that yet. That's your goal, not pushing it to the ground the first time, okay? At least 10 to 15 of these, nice and slow with breath, watching that the arch in the back doesn't lift up. That's what I don't want you to do, pulling that belly button in. Oh my goodness, this is so good for your shoulders. Okay, so next thing is opening up those elbows at a 90. Again, this side is not a good illustration, but you can see with this one. Maybe start in extension here and just see how far of a range of motion you have, making sure your wrist is down on the ground and your elbow is down on the ground. Okay, this just might be enough of a stretch for you to stay still and breathe. Otherwise, if you can bend it, next step, next level, we're going to bring the elbow down to the rib cage in a 90 and move it up over the head with the other arm too, okay? Without arching the spine, keeping the belly in. Remember, you're going to do both legs, switch sides, okay? Do these 10 to 15 times. If you can't get that elbow down, open the arm and do them full extension. The bent elbow is your second layer, okay? These movements are going to help you roll those shoulders open, get some strength, gentle strength in the back of your upper back so that we're pulling all this weight up and erect so that we have a perfect posture, so that my ear, shoulder, hip, and ankle are in alignment even when I'm sitting up. Okay? This is so important. I want to know, I want you to know, I want to know, first of all, how you feel about this stretch, what you think, if you've tried it. And I also want you to know I'm so passionate about your health and getting back into feeling alive again, feeling like you are an important part of the family again, by just releasing the pain. And this is where it starts, guys. Next video, I'm going to show you another modification of this if this seems too complicated, but I want you to try it, okay? I'm so happy you're here. I'm so happy you found me. Please comment, please follow, and please keep watching, because there's going to be so much more that we're going to get into for your health, for your empowerment, so that you can be the mom that you always dreamed to be. And it just takes a little bit of encouragement and a few movements, and you will be there. All right, let's do this together. I'll see you soon.